WWE is currently experiencing an outbreak of the coronavirus at its performance center in Orlando. Multiple WWE employees have come out publicly and confirmed that they have tested positive for the virus. These include Renee Young, who is said to be feeling better now after having been bedridden with the virus last weekend. WWE producers Adam Pearce and Jamie Noble have each come out and said that they have tested positive, as has announcer Kayla Braxton, who revealed that she has tested positive for the virus twice now. The outbreak comes on the heels of WWE coming under fire for a policy of not allowing developmental talent acting as fans at tapings to wear masks. WWE sent this statement to media regarding the mask policy that had been in effect until recently at the Performance Center. Here is what the statement says. Fans have not been in attendance at WWE events since March 13th. Yesterday, a select number of friends and family were permitted to attend WWE's TV production. These individuals were required to participate in medical screenings prior to entering the closed set at our training facility and were kept apart from in-ring performers and production personnel. Attendance was below 20% capacity and social distancing guidelines were adhered to with at least 6 feet between parties, thus face masks were not required. Now, following multiple positive COVID-19 tests from its employees, WWE has since permitted the use of masks at tapings, as evidenced by those in the crowd on Smackdown who were wearing them. Up until recently, WWE was not testing people for the virus before permitting them into the Performance Center. This has since changed. WWE has sent the following to media in regards to the testing they will be doing moving forward. Here is their statement. WWE will continue COVID-19 testing of its talent, production crew, and employees in advance of TV productions for the foreseeable future. Now that WWE will be testing all wrestlers and staff at TV productions moving forward is good news. The unfortunate news is that the virus has already been allowed to spread to the roster and others employed by the company. This is something which could have been avoided if testing had been brought in before employees started to get sick. The spread of the virus at the PC could have also been slowed down if masks had been used. So now who does this put at risk? While many on the WWE roster are healthy and young, many others are still vulnerable to the negative effects of the virus. Daniel Bryan is asthmatic and potentially at greater risk of suffering negative impacts from the virus. He has been at the PC regularly since the global pandemic began, but not on the most recent edition of Smackdown taped after the outbreak at the PC took place. 71-year-old Ric Flair was recently a part of Raw tapings and is now aligned with Randy Orton. Flair has had a slew of health problems in recent years. Now, if the outbreak at the Performance Center does anything to impact Ric Flair's quality of life or his overall mortality, it would make this story one of the most negative in the history of pro wrestling. WWE producer Adam Pearce's positive test has reportedly worried some in WWE as well, as Pearce had been working closely with Bruce Pritchard and the 74-year-old Vince McMahon, possibly exposing both to the virus. It's entirely likely that WWE felt they had no choice but to soldier on with tapings due to their television contracts with Fox and USA. Failing to provide the content they are contractually committed to provide the networks with could have led to termination of the agreements regardless of how the company was impacted by the global pandemic. It's probably likely that the next round of TV contracts from any promotion will include clauses about what will and should happen in case another global pandemic is to take place. The policies WWE has now implemented, such as allowing masks and testing for COVID-19, will help to stop the spread of the virus at the PC and hopefully prevent further outbreaks. But they are what should have been done to prevent an outbreak, not used as a response after an outbreak has already occurred. That is how WWE's COVID-19 policies have put profits before people.